Oh, I think he got it.
Then I was showing the backup.
Didn't you do your yoga thing with it?
Stay there. Wait a second.
Oh,
Hold on.
So why did I become so obsessed with magnesium? Well, 31 years ago, I was in a total stress burnout. I could hardly keep my eyes open during the day. I had what I call a nodding off syndrome. My head would start bobbing up and down, my eyes would start to close, and being a psychologist, that was not a good condition to be in. We're supposed to be alert and aware and perceptive and be able to think clearly. When you have an acute magnesium deficiency, the brain as well as other body cells need magnesium to operate properly. Many people with an acute magnesium deficiency find their mind is in a fog. Not a healthy condition to be in. And so, fortunately, I had a friend who was very knowledgeable about many of the symptoms on the checklist. And he also knew about magnesium deficiency and heart attacks and diabetes and blood sugar problems. And I was on the brink of going from an acute low blood sugar of 45. For those of you who know how low a 45 is, that's just above being in a coma. So, my medical doctors were totally baffled. They could not figure out what was wrong with me. But this friend of mine, who was a PhD educator and well-read in science and nutrition and magnesium, knew about the connection between magnesium deficiency, heart attacks, diabetes, and other very, very serious health problems. And so he convinced me to get a hair mineral analysis. When he got the results, he greeted me with this. He put his thumb and finger together and said, "Rick, you're this close to a heart attack." That got my attention, and I asked him, "Well, how did you come up with this?" Well, he looked at my hair analysis, and my magnesium wasn't even on the chart. It was rock bottom below. And so he told me about the literature showing the correlation between magnesium deficiency and heart attacks. And there's an excellent magnesium website called Magnesium Water, mgwaters.com. It was built by a man by the name of Paul Mason. He's got a wealth of articles on magnesium deficiency and different health problems, and the importance of having magnesium in the diet, in supplements, in the water system. You know, because water softeners take out the calcium and magnesium.
How do we find out if we have low magnesium?
So you find out you have low magnesium by getting a hair mineral analysis. I discuss this in my book, The Strands of Health, A Guide to Understanding Hair Mineral Analysis. And so Paul Mason, on his website, estimates that since 1940 to 1994, that there were probably about 8 million preventable heart attacks related to magnesium. That's 1940 to 94, and I would estimate there's probably been several million more preventable heart attacks, fatal ones, connected to magnesium deficiency.